The National Health Service has for decades depended on the talents of all of the people of this country, and indeed many from overseas who come and devote their professional careers to supporting patients in this country. The fact is that 1 in 5 of our staff in the National Health Service are from black or minority ethnic communities. But often the treatment that they get at work does not correspond to the values that the NHS represents. So the reason that the workforce race equality standard matters is threefold. First, because, statement of the obvious, we should treat people with respect and fairness. That goes with human rights, and that goes deep to the core of what each of us believe. But actually there are 2 other really important reasons as well. The second of the 3 reasons is that we've got a huge reservoir of talent which at the moment we are not fully tapping into by virtue of the barriers that we place in the way of the contributions that 1 in 5 of our staff can make. And so when you think about the promotion prospects, the support that people get, you see the stratification, if you like, that occurs, the direct and indirect discrimination across the National Health Service. And so if we want to make full use of the hundreds of thousands of people from diverse backgrounds in the National Health Service, then we've got to tackle workforce race equality. But there's a third reason as well, which is that if we are in the business of reducing health inequalities, which we are, then we need to be much more sensitive and open to the different needs, the different ways of engaging, the different preferences that all of the communities that we're here to serve represent. And the fact is that often some of the most dissatisfied people with the care that they get, often the people who find services hardest to interact with and as a result miss out on prevention opportunities and end up, say, getting their cancer or their mental health treatment much later, often when it's harder then to give them a good outcome. Those are people who miss out because the way in which our care is provided is not sufficiently grounded in the communities that we're here to serve. So tackling the diversity of our workforce will also have an impact on our ability to reduce health inequalities.
The 5-year forward view is a policy that we have within the NHS England. It's an important policy, it's an important strategy. Without having black and minority ethnic people at the very centre of our thinking, it will be very, very difficult to deliver on the 5-year forward view, which is looking at different models of care. Looking at different models of care means that you have to be innovative, creative, and think in a different way. If we're looking at thinking in different ways, we need a diverse workforce to be able to do that. And having black and minority ethnic people in all sections of the NHS at all levels is absolutely fundamental and key to us making sure that the 5-year forward view is delivered and high quality patient care comes as standard to all our patients across the whole of the NHS.
Workforce race equality is critical to the success of any organisation in the 21st century. It's not just the NHS. If you look across all the major corporate enterprises in the UK and internationally, every one of them, I think, is starting to get the message that workforce racial equality and diversity just has to triumph in terms of the service that an organisation can provide to its customers. And for us, we know that there's a strong correlation between diversity of our workforce and the outcomes for patients and the quality and safety of the delivery of healthcare in the NHS. What I would like to see us being able to do with these standards and with the indicators that are built into them is a change in mentality, is a change in strategic approach to workforce matters. And if the standards can deliver that for us, then that's a major step forward. And I endorse them wholeheartedly from that point of view, but don't let them become tick boxes and grindingly boring duties that have to be undertaken. This is much more imaginative and much more strategic and important than that.
Workforce race equality is crucial in the NHS for the following reasons. A significant number of the NHS employees, people who work for the NHS, are BME, and we need to ensure that we are a good employer. I mean, it's not rocket science, we need to be a good employer. We've neglected race as a factor in both the delivery of health and social care services and in the employment practices within the NHS for far too long. And it's starting to show. It's starting to show in terms of leadership, it's starting to show in terms of outcomes, and it's starting to show in terms of morale. it's too costly for us not to, and it's immoral not to.
So it's about fairness, yes, but it's also about capitalising on the huge talents of our whole workforce, and in so doing, it's about tackling the deep health inequalities that still exist in our country. So this is not a tick box exercise. This is about looking at the NHS, all of our performance in the mirror and saying we can do better. There are employers across the country, there are parts of the National Health Service that have done fantastically well. There are other parts that have still got a lot of progress to make. So thank you for your leadership in this. It will be strongly noticed and warmly welcomed by our fellow staff in the National Health Service and by the patients and the people that we're all here to serve.